In this video, we will talk about asherman syndrome. Asherman syndrome is a syndrome where there are adhesions present in the uterine cavity, which will decrease the size of the cavity, uterine cavity. So first we see the adhesions in asherman syndrome. Second, we see the thinning of the endometrium. The causes of asherman syndromes are one is that it's a vigorous curettage. Curettage is scraping of endometrium lining inside the uterus that they do vigorously. So vigorous curettage is first cause. Second cause is curettage postpartum, like after the baby is delivered, the placenta is scraping of some. They scrape out the placenta if it is not. If it doesn't come out, so they do that postpartum curettage. That can also be cause of asherman syndrome adhesions. Third cause is TB. Third cause is genital TB. It's genital TB, and fourth cause is infection of schistostoma. So we tell it schistosomiasis. Infection of this is some blood luke infection. Now we will see the clinical features of asherman syndrome. In clinical features, the patient present with abdominal pain, amenorrhea, and hypomenorrhea, and they can also present with sterility. This is the most common presentation. In management, we do investigations and treatment. In investigation, we can either do USG or hysteroscopy. In this hysteroscopy, this is the main gold standard because it is both diagnostic and therapeutic. So we do hysteroscopy. In treatment, there are three types of treatment. One is a surgical and a physical, and third is medical. We give medical we give hormones like estrogen and progesterone, and in physical we give a pediatric folic acid catheter. We insert it in the uterine cavity, and forced water is spilled here so that the cavity is cleared with the adhesions. In surgical procedure, we do hysteroscopic adenolysis. This is a hysteroscopic surgery. We'll discuss about it more. Hysteroscopic adenolysis. Hysteroscope is passed into the uterine cavity, and the surgeon gets magnified view of the adhesions, and one more instrument is also passed which also cut the adhesions. So like that the adhesions are cleared and they get to know the view of uterine cavity, like in irregular lining is also seen. Hence it is both therapeutic and diagnostic value as well. So we have learned about asherman syndrome, where we learned what it is, what happens there, and we also learned clinical features. We also learned causes. We also learned the investigations, and we also learned treatment.